Hi everyone, welcome back. It's been a while and we've sort of had a summer up north. It's been much hotter down south. I went to visit my parents for the first time recently and it was like traveling through a wormhole into a parallel universe. It was so hot. So I hope those of you living down south have coped with that heat. And I hope that you've all been keeping safe and well, particularly as this pandemic keeps dragging out, and that you're managing to find rainbows and silver linings in all those overcast clouds that keep passing us by. And every time we think maybe, we're told no, we're going to have to keep shielding or keep ourselves safe. But I just want to give you a huge thumbs up for your support you're giving each other during this crisis, on the community posts on Facebook, and the way that you're engaging with the various videos that are being shown to physio, tai chi, so well done. You're making an effort, and sometimes it's easy just to say, oh sod it, I'm feeling sorry for myself and I give up, but you're not, and you're carrying on and you're supporting each other. So you should be proud of yourself and give yourself a big hug. Give yourselves a hug and then pat yourselves on the back as well. So today is going to be a nice short podcast because we're talking about stroke and why it seems to be more prevalent amongst those of Black and South Asian origin. And I thought I'd also tie it in with the increased incidence of sort of extreme sort of sequelae when you have a coronavirus and you come from Black and ethnic minority background as well. That can be more likely to have severe disease outcomes from developing the coronavirus, or actually sadly passing away from it as well. So I thought I'd talk about that as well, because you will find there's a bit of an overlap, well actually quite a bit of an overlap between why people from what I will now describe as the BAME community, Black and ethnic minority community, why they are more susceptible to stroke, and why they're also more susceptible to becoming more unwell or even sadly dying from COVID. So we'll start with BAME, the BAME community and the incidence of stroke. If you're South Asian, African or Afro-Caribbean in the UK, your risk of developing some heart and circulatory disease can be higher than in white Europeans. Research shows that the risk of stroke amongst people of African, Caribbean and South Asian origin, that they're twice as likely as the general UK population to develop stroke. And the stroke mortality rate in England and Wales is almost double that for people born in Jamaica. And it's actually 2.5 times for those men who are born in West Africa. Now, more specifically, drilling down, if you're South Asian, so that's coming from India, Pakistan, Sri Lanka, sort of the South Asian sort of countries, you're more likely to develop coronary heart disease than white Europeans. If you're Black and of African or Caribbean origin, you are more likely to develop high blood pressure or diabetes or have sickle cell disease. And all those are risk factors for stroke. And of course, things like diabetes, heart disease, high blood pressure can occur in all of us, regardless of the colour of your skin. So it's just that for some reason, if you come from a BAME community, you seem to have more likeliness to develop those conditions. And there isn't a clear answer as to why you may be at increased risk, which I know is going to be annoying you because you're saying, but we want to understand. Well, what I will say is that there's some good ideas behind it, and genetics likely play a part. But as with all diseases, it's never simply this or that. It tends to be what we call multifactorial. So yes, genetics can play a part, but you can override genetics if you can mitigate against all the other potential things which can predispose you to developing an illness. So for example, lifestyle choices can also affect your risk. And I think we're increasingly understanding just how important lifestyle is in affecting your risk of developing any disease process. And I think if you bared your way through my rather long previous podcast, you'll see just how much simple things you do with your lifestyle, like how you eat, how you move, how you sleep, how you allow stress to affect you. I think you may have gathered some information just how much they impact on your physical health, not just on your mental well-being. So, you know, there is evidence out there that your lifestyle can be as important, if not more important, than genetic risk factors. And that's good in a way, because that suggests, well, maybe you have part control over some of the risk factors for developing disease. And we do know that smoking doubles your risk of having a stroke. And many Black people don't smoke, but research shows us that out of all the ethnic groups in England, that Black Caribbean men and women, especially younger women, have some of the highest rates of smoking. Now, I was actually surprised at this because I don't know any of my Black friends who smoke, but apparently the highest incidence, or some of the highest rates of smoking, is occurring in young Black women. And to be honest, it's occurring in a lot of young Black females, full stop. So it may be partly reflective of that. I mean, I know from my days working in family planning and sexual health that young girls did often admit to me that they smoked because it was a good appetite suppressant in a day of, in an era of body dysmorphia, where young people are particularly sort of self-aware of their body shape, not helped by media, I guess. So certainly smoking is a very important risk factor for stroke. Studies in England have also shown that those people from Black African and Black Caribbean backgrounds, particularly women, are more likely to carry weight around their waist. Now, you know, we all carry weight, and more so as we get older, particularly in women when you go through the menopause. But usually you distribute that weight on your hips, and yes, in the after the menopause, you can get more weight on your waist, and so you go from being pear shape to apple shape. But in Black African and Caribbean women, they are more likely to have more weight around their waist to their hip, what we call your hip to waist ratio. And it's been shown if you do have that, so if you happen to be more apple shape rather than pear shape, or just generally if you carry a lot of weight on your waist, regardless of how big your hips are, that is an independent risk for developing conditions like high blood pressure, diabetes, and other health problems like osteoarthritis. So if you, I mean, one thing we know, I mean, I'm from an Asian background, and when I go home, food is like the center of everything. It's the way you give the people you love a big sort of foodie hug, and you know, you have to be literally waddling out of the front door, or else you haven't been properly looked after and taken care of, which is great in one respect, but it can go over the top. And in Asian communities, there's a lot of frying of samosas and pakoras, and lots of nice Indian sweets, which are absolutely saturated in sugar. And of course, you know, some Asians still use ghee in their cooking, which is not a great way of cooking. But there's a lot of really good, healthy stuff in Asian food. And the same in African and Caribbean food. Lots of really healthy, tasty foods. And it's no accident that, you know, people often resort to those meals who from all different nations because it is such tasty food. But the problem is that, you know, things like jerk chicken, beef jerky, corn and pineapple fritters and plantain fried, they are high in saturated fats. So, and same with pakoras and samosas. So, you know, the trick is to look at these things as treats rather than part of your daily diet. And so to think about steaming, boiling and grilling for your regular meals, because these are all so much healthier than frying on a daily basis. And keep the fried foods for those occasions when you're having friends and family round, or weekends, or when you just have had a really rough week and you need to treat yourself, because we all need to treat ourselves. Just it's not healthy to be having those sort of foods regularly. And those saturated fats can definitely contribute to then putting that weight around your waist, which then increases your risk of developing the conditions which predispose to having a stroke. The other thing which can affect your risk of having a stroke is blood pressure. And we know that too much salt can increase your blood pressure. And so you shouldn't eat, and I mentioned this in my diet podcast, more than 6 grams of salt a day. And that's equivalent to just over a teaspoon. And that's actually very, very little when you think about how much salt is hidden in foods, particularly things like processed foods like ready meals, crisps, nuts, cake, biscuits, salt fish, corned beef, bacon, salt pork, processed meats, and also in pre-mixed flavorings such as jerk, seasoning or curry powders. They can also be really high in salt. So it's good to try and use alternatives like fresh ginger, lemon juice, chilies or dried herbs and spices like paprika or pimento to flavor your food instead. And also avoid adding salt to food when you're cooking or when you're at the table. Because we do know that if you're Black African and Black Caribbean, that you are more likely to be more sensitive to the effects of salt. So particularly if you're from those backgrounds, you really want to start considering the salt content and uptake in your diet. And if you think that you're perhaps having a bit more than you should, you know, gradually reduce it down, because, you know, you don't want to be suffering, but you will be surprised how your body can adjust to small reductions over a period of time, and eventually you get to a point where you prefer it with less salt in, a bit like when people reduce the amount of sugar in their tea and then eventually have no sugar in their tea to a point that they say, oh, I don't like it with sugar in anymore. So it's possible to do, but just be kind on yourself during the process. Don't do it like completely omit all salt and feel sad for the rest of your life. Now, hypertension. We talked about smoking, we've talked about weight and diet. Hypertension, that's a really important one as well. And that's as a cause of stroke and in the BAME community. And, you know, it's multifactorial, the causes of hypertension, but think of the word itself. And hypertension is high blood pressure, by the way. Think of the word hypertension. It's like basically too much tension in your body and in your mind. And I think that's a really good way of thinking of high blood pressure. Too much tension in your body and mind. And it could be partly linked to factors that I'll come on to when I discuss the next section now, which is BAME and COVID. Because I think that, as Professor Fenton alluded to, when he was asked to commission a report on why those from Black and Asian backgrounds were more likely to develop COVID and die from COVID, when he wrote his report, he mentioned some things which I think are extremely important, but because they're perhaps not so easy to quantify in a test tube, they are often overlooked. But I personally, and I know that there's a lot of evidence to support this, believe that these are very important factors which contribute to why people who come from Black and Asian backgrounds are more susceptible to developing disease and therefore being more susceptible to things like COVID as well as stroke. So moving on now to COVID and why it affects those from minority groups more. Professor Fenton, when he wrote his report, and you may remember there was a little bit of controversy around this because his report, which was commissioned by the government, was then seemingly buried. You know, there wasn't any action taken from it. It wasn't even mentioned. It was only because it was leaked and it suddenly came to light that he'd written this report, and the information, it was frankly a bit damning. And I think the government didn't really want it exposed because it wasn't really reflecting well on maybe the way the country supports those from Black and Asian backgrounds. So, but I think that the factors that he mentioned are really important to talk about, because he said that the following factors are key in why those from Asian and Black backgrounds are more likely to develop COVID. He said that social and economic deprivation was very important. And he also said that there were 4 structural issues. And these were 1, racism, 2, discrimination, 3, stigma, and 4, distrust. Now, I don't know if any of you saw the recent series, excellent series actually, The School Which Tried to End Racism. And that was very telling and very interesting. And you could see from a young age the kind of the subtle stresses that are already present in children from Black and Asian backgrounds. And there was a very poignant moment when they were all on the racetrack about to start a race, and then they were asked a series of questions, and this was a mixed group of people from all different ethnic backgrounds. They were asked a series of questions, and effectively, if you answered positively to these questions, you had to take a step back, which meant you would start behind the starting line before the race. And the questions were all around things like, you know, have you ever felt that you wished you were of a different colour, that you've always been the only person in a room of your colour, that you've been treated badly on the basis of your colour, or you know, had some sort of discrimination. And what was very telling was that before the start of the race, it was only the Black and Asian kids that were standing way back from the starting line, and it was a metaphor for the uphill battle that sometimes is experienced by youngsters and adults from those communities in wanting to get to the same endpoint, that you have more obstacles and hurdles and challenges to get over in order to feel that you can be treated the same or to have the same opportunities. Now, and I think that's what made the government uncomfortable when Professor Fenton wrote his report, that it was basically saying that there is an inherent sort of institutional racism, discrimination, stigma, and distrust, which are structurally embedded in our society, which creates stress. And stress, as you will remember from one of my podcasts, has a significant effect on our health and well-being and should never be underestimated. It really shouldn't. You know, as I said, think of the word hypertension. Well, if you're under stress, then your body is full of hypertension. Now, there is a possibility of a genetic cause for the disproportionate number of ICU admissions in Black patients. So yes, absolutely. And there were some studies done in South Asia which showed that if you have a low vitamin D level, which a lot of South Asian and Black people have, then you are more likely to have a more serious complication from the COVID disease. So certainly there are some who advocate that you should take vitamin D, additional supplementation if you are from those backgrounds, and that there may be other genetic causes which predispose people from those backgrounds to be admitted to ICU units. The larger than expected numbers of cases in Black patients may also represent an effect on different social or cultural factors, leading to more cases in these groups overall than is just simply reflected in the ICU admissions. So we'll elaborate a little bit on that in a minute. We'll talk about social and cultural factors. It could alternatively be the burden of chronic conditions which predispose to severe COVID infections and therefore ICU admissions, which is higher in ethnic groups. So, I mean, it's probably going to be a bit of everything. You know, the fact that if you're from those backgrounds, you're more likely to have the burden of a chronic disease. You're more likely to have a genetic predisposition, and you're more likely to have social or cultural factors as well, which will influence it. And so and we do know that people of Afro-Caribbean descent have higher risk of getting hypertension, type 2 diabetes, and that Southeast Asians are more likely to develop coronary heart disease. And you know, we also know that observational data suggests that Black and Asians are more a greater risk of developing serious illness from COVID-19. And I looked at some quotes from various professors of intensive medicine, intensive care medicine, and professors of epidemiologies who've been giving their thoughts, because obviously they've been seeing a lot of cases in their units, and they were giving their thoughts, and it's been interesting to sort of get a flavour and of what their opinions are, and they're based on not just on observational data, but it's based on a lot of historical knowledge and also on a lot of their embedded research knowledge as well. So what I'm going to be saying now is based on what's been said by these experts and people working at the coalface, more importantly. So what's been said is that it could be that the cases are greater amongst these groups because of socioeconomic factors. We do know that those from the BAME community are more likely to live in densely populated areas. And they're more likely to live in multi-generational families, so where you have grandparents living with grandchildren and the generations in between, and that they will all live in the same household, and that these people are also more likely to have what we call public-facing jobs, which we know, you know, all of which would make the likelihood and duration of exposure to the virus more likely. And of course, that's the other thing. It's not just about getting the virus, it's about the intensity of the exposure. So we know that one of the issues is that if you work in a public-facing role, or you're living in a household with somebody who has got silent COVID disease until it presents maybe a couple of weeks into the illness, that, you know, by having a high level of exposure, by being close to somebody who is heavily infected, that increases your risk of having more serious disease. So it's not just having the disease itself, but how great is the viral load in your body, which seems to be greater if you live in sort of households where there's multi-generations and where you are working in public-facing jobs, possibly dealing with people who have COVID, whether it's in a care home, in a hospital, in going into people's houses, providing a care service, or residential places, or whether you're a taxi driver, you know, who's, you know, set in a car with lots of different people coming in and taking them on long journeys. So all these things can increase your likelihood of getting the virus, but also the duration of exposure to the virus. Ethnic minority groups are much more likely to live in densely populated cities where we know the transmission rates are high and the ability to properly socially distance are relatively low. So, I mean, I live in a very rural area on the outskirts of Darlington, and we don't even live in a village, it's like a hamlet. And we have, you know, we had one case in a chap who works at the hospital, but other than that, we've had nothing. And And yet I know that in Teesside, where we have, or in sort of around Greater Durham, where there's some very built up communities, there has been some hotspots of COVID cases. And so it does seem to be more apparent in areas of high density. And we've seen that in Greater Manchester, you've seen it in Leicester, we've seen it in parts of Aberdeenshire as well, and of course originally in London. Now, so, and people from the BAME community are more likely to live in those densely populated areas than they are in the countryside. Another explanation is that the virus has so far hit densely populated areas like London first, where again the BAME community is very high. And most of the early data has been coming out of ITUs in London or from other densely populated city centres like Manchester, which have also got a high BAME community. And there are some who say that maybe as time goes on, we'll see a levelling off of the racial disparity as the rest of the country is affected. But we're quite a few months now into this pandemic, and we're still noticing that it does seem to be more prevalent in areas of high social density. So as I say, County Durham, where I live, is generally a fairly sparsely populated overall, with pockets of density. And what we're finding is it's in those areas where there are pockets of density that we're getting isolated breakouts, but not generally amongst the more dispersed population. So I think we'll probably find that doesn't bear true as time goes on and as the rest of the country is affected. And also, the fact is that doctors and nurses from the BAME community have been affected nationwide, and they haven't all come from densely populated cities. And the only case of a GP death in this area was actually a friend of mine who was from Southeast Asian community similar to my own, and she was a similar age to me, and she worked in quite a rural part of Durham. So I think that on balance, it looks as though there is something more than just the where you live that contributes to this, and that there is probably going to be multifactorial, that you're more likely to be exposed if you live in a densely populated area, but that there are things inherent in you, whether you are more likely to carry a disease burden or whether you are more likely to have a genetic predisposition, that will also contribute to your risk of getting COVID more seriously. There could also be biological reasons for the difference, which we can speculate on. And one thing very visible, and this was mentioned by a professor of ITU in London, and it's something that I think Boris has picked up on with his new desire to reduce the obesity levels, which people have been desperate for him to do for years. But basically, the professor said that, isn't it surprising that people who have severe lung diseases like COPD, severe asthma, are, say like an existing lung disease, who end up in ICU, are less likely to succumb and to develop the more potent risks from COVID than people who come in who have diabetes, who have high blood pressure, and who are possibly a bit overweight, like Boris, bless him. And I think he picked up on that, because obviously somebody in the hospital said, you're a bit overweight, that might not have helped your risks for getting this. And he was surprised that those risk factors seemed to be a worse indicator of outcome than having a pre-existing lung condition. That you're more likely to develop serious lung disease requiring then ventilation or ICU admission than if you had a pre-existing lung condition. So, and of course we know that all those factors, the high blood pressure, the diabetes, the being overweight, are more prevalent in those from Black and South Asian backgrounds. And of course, those are also the risk factors which increase your chances of having something like a stroke. And before I finish, I'm just going to say one other thing on stroke, and that is that, with blood pressure, it isn't just about your blood pressure in a, you know, how it is in a snapshot of time. It's also how it fluctuates. So if you're somebody who has a lot of stress in your life, you may be okay, but if you have a sudden surge in your blood pressure because you're extremely stressed and you already have a bit of hypertension, then it's those sudden rises and drops which increase your risk of developing things like stroke and coronary heart disease than having even just a constantly raised blood pressure. So just be a bit aware of that. If you're somebody who has high blood pressure or who has been told you're borderline, you know, be very aware of avoiding lability in your blood pressure, lability in your mood if you can. And if you think stress is something which is inherent in your life, I do strongly advise that you seek ways to try and reduce that, because there is so much more emerging evidence for how stress can affect the disease burden on your body. But also, in summary, you know, people from Black and ethnic minority groups are more likely to have diabetes, stroke, are more likely to have smoke, more likely to have coronary heart disease, and are more likely to carry a bit more weight, and they are more likely to have some stressors from some of the social and cultural things that come with living in a country where you're not the indigenous population, and sometimes feeling a little bit excluded and feeling that you have to make that bit more effort, and the stresses that can come with that. I mean, they've done studies on animals that have shown exactly that, that if you're feel that you're at the lower end of the social spectrum, or that you are not included, that it actually increases your risk of developing diseases. And it makes sense also because we know that people from white backgrounds who come from poor, deprived areas are also more likely to have disease burdens as well. And so those factors are also important, as are probably the genetic causes as well. There was one other thing that I wanted to discuss just before I forgot, and I realised I hadn't mentioned it, and that was sickle cell disease. And it was just briefly to say that, you know, people from Black, Afro-Caribbean backgrounds are more likely to have sickle cell disease. And sickle cell disease can be you can reduce the effects of sickle cell disease by making sure you drink plenty of water, that you take regular exercise, that you eat healthily. And we also know that with sickle cell disease that there are triggers for this, and these can include very hot or cold temperatures, stress, and smoking cannabis. So sickle cell disease, which is specific to those from the Black community, if you have this condition, then it does predispose you to stroke. And you'll know more about this condition than I will if you have it. And I'm sure you've already been told the triggers for it and the things that you should do. But in case you weren't aware, you know, make sure if you have this condition that you are drinking plenty of water, taking regular exercise, and eating healthily. And to be honest, drinking plenty of water, taking regular exercise, eating healthily, that pretty much applies to everybody if you want to feel good and live better. So I really, really hope and pray that you are staying safe and you continue to stay safe and well. And I'm going to say bye for now. And thank you for listening to this podcast. And I hope you found it a little teeny bit helpful. Bye for now. Bye-bye.